Hello viewers and welcome to another edition of our women's program Caregiving. Today we are gathered in the studios to take up a very important and a very interesting topic, and today we are going to discuss on the impact of caregiving on the caregiver. Now, as a society, we have always depended on family members to take care of our loved ones at home who may not be so healthy, who may be having physical ailments, sometimes very serious ailments. But that has been the tradition in our Indian homes, especially to take care of them and to look after them, especially in their old age, if we have infirmed parents or grandparents or senior citizens at home. Well, a caregiver's role can be of varied types and varied forms. As long as a caregiver is healthy and she's willingly doing it, and it is not so much, she's not so much pressurized, it is fine and all seems to be okay, and if she can balance her role or his role. But the problem arises is when a caregiver over a long period of time continues to give care, because often we have seen a caregiver also has her own life to look after. And it is said, and studies have shown, that a caregiver goes through several psychological problems, emotional turmoil, and may not be capable enough or trained enough also to look after the infirm, the sick, or the dependent ones in the family. So today we are here to discuss with the specialist here to understand the role of a caregiver and how does it impact her over a long period of time. What are the psychological, the emotional impact, the stress, the turmoil that a caregiver has to go through. Well, we will understand all of that, and to tell us more, we are joined here in the studios today by two of our panelists. To my extreme left is Dr. Chainika Sharma. She is a consultant psychiatrist of Super Care Hospital in Shillong. We are also being joined by Roshni Subba. She is the President, Society for Empowerment, Education and Development, or SEED. Well, these are our two panelists here today to discuss on this topic that we have taken up, and thank you so much both of you for giving us your time. And we will be discussing this on a threadbare basis. But before I go ahead and discuss the whole topic with them and the various facets of it, we will just take a very quick break and watch a short clip, a short video on this topic that has been arranged for you, and we will come back soon after you finish watching this video.
Caregiving, the most draining activity of one's life, be it emotional, mental or physical, yet it remains the most underrated part of life. As society lives and thrives, people are born, grow up, live their lives and pass on. The in-between of this passage from birth to death is the phase where the caregiving comes into play. As parents, siblings, family members age or suffer from debilitating diseases, it is here that the role of the caregiver comes to the fore, wherein it is invariably the women who undertake this role. What are the positive and negatives of such a situation, and what effects it has on the caregiver are some of the issues that the experts are going to delve upon. Let's take a look.
Welcome back, dear friends and dear viewers. And yes, as I said, today we are in the studio to discuss on this important topic, that is the impact of caregiving on the caregiver. Welcome back. Thank you once again for your time. It's lovely to have two beautiful ladies in the studio to discuss this very, very crucial topic. Dr. Chainika, I come to you firstly. Can you explain to me and to all of our viewers who are watching this program, who is a caregiver? What do we understand by the term called caregiver?
Well, a caregiver is a person who may be a family member or a volunteer, say a friend, a neighbor, or a paid helper who takes care of children, especially those with special needs, elderly people, or someone who is sick or who is having some limitations due to injury or having some medical or some physical disability, because of which they are not able to take care of themselves and they need help.
Right. So he or she is considered a caregiver. Ma'am, you just said that, caregivers can be of various types.
Yes.
One is, of course, a professional caregiver
Yes.
who gets paid and who's trained. Say,
Yes.
for example, a nurse. She can be considered an Aya, is a trained caregiver. But then there are a lot of family members also who are giving care or who are taking care of their families, aged parents or, sickly parents, etc. So can you describe also quickly the types of caregivers that we have?
There are various types of caregivers. The first is the family members, so who actually take care of their loved ones.
Okay.
And then there may be some volunteers, say someone is sick and a neighbor or a friend volunteer to take care of. And along with them, there are the professional caregivers for whom the caregiving is a career. So they may be working part-time, they may be working full-time, or it may be that some are specialized to take care of some special diseases or disabilities. Also nowadays some virtual caregivers are available who take care of those people who do not need physical assistance.
Okay.
So they basically give advice on through social media, phone, etc., like keeping a track of whether the person is taking medicines in time, whether they are following the schedule they are supposed to follow. They boost their moral support, they give a moral support, they encourage them, motivate them, and also discuss the problems they go through while handling with their sickness.
Okay, that's very interesting. A
Yes.
virtual caregiver as well.
Yes.
All right, things are changing, right?
Yes,
With the coming of
definitely.
technology, things are changing.
Yes.
It's so interesting that you have brought out the various types of caregivers also. But then, ma'am, I'll be coming to, of course, Roshni Subba in a little while from now. But then I would also like to understand, like what I said right in my introduction, that caregiving for a professional who takes it up as a career is okay because he or she gets paid and trained. But then
Yes.
when we come to the family level, a caregiver who's continuously giving care over a period of time may not be so simple and may not be so easy.
Yes.
And that is why that's what we are trying to bring up today, right? So tell us, ma'am, what is it that sometimes or often a caregiver can go through, the emotional turmoil, the psychological impact that it can have on, the tediousness of the same job over and over again?
Yes. Caregiving is a very challenging work because it not only it is that a person is giving care, he or herself or himself is also undergoing lots of stress because they face many problems while handling a closed one. First and foremost, though, many a times we find that the caregiver is having problem because they don't have adequate knowledge about the problem the person is going through. Suppose someone is sick, then the caregiver, they start panicking like what we should do, what we shouldn't do while taking care of that person. So at times they may do things which they are not supposed to do also. For example, a person is having diabetes. So the caregiver, if doesn't know properly what food to give, how to manage that person, what time to give medicine, they may rather do things which will be detrimental for the person. So this lack of knowledge is a very challenging situation which caregivers in the family face because they are not from a medical line or they are not equipped to handle them or nor they are trained to handle these people.
Yeah.
Another thing is time management, especially for those caregivers who have to take care round the clock. Suppose someone is bedridden or having a chronic illness, then managing time for themselves becomes very difficult for them. And then when they cannot give time to themselves, they themselves start undergoing some, say, physical stress, mental stress. They may be deprived of sleep. They may be suffering from some sicknesses because of inadequate care, maybe not having food in time, maybe not having adequate rest.
Absolutely,
and along
yeah.
with that, they may have lots of mental stress also.
Absolutely.
Because along with giving care, they are seeing someone who is close to them suffering.
Right.
And they at times feel helpless because even after care the person is not improving or the person is deteriorating. This becomes very challenging for them.
Absolutely. No, we will come back to these challenges because I'm sure there are plenty of challenges.
Yes.
But there is a person here with us, that is Roshni Subba. You are working and you are holding very responsible position in your workplace, and you've also gone through this phase where you had to take care and you're still taking care of your elderly parents, right? So Roshni, it must have been difficult for you, or it is difficult for you perhaps sometimes, to balance both, you know, your workplace and then taking care, because you are in your family a caregiver. Tell us your experience about yourself.
Exactly what you said is very right, and what doctor has just mentioned is very correct. Caregiving is really very challenging. It's not always possible to have a caregiver where you hire them as a profession, because you know, there are so many things that one thinks about hiring a person. First of all, you are emotionally connected to the person in your family, and you feel that the way you give care to your parents
Loved
or your
ones,
family
yes.
members or your loved ones, the others may not justify the way, you know, there's the satisfaction doesn't comes. And of course, as the doctor just mentioned, it's very challenging. And as you mentioned that a working lady and also giving care to someone at home is really very challenging. You know, if I may elaborate it, first of all, it's the time that you need to manage the time between your family and your work. So it's very stressful. You know, how you justify your taking care of your family members at home and also not neglecting your work, and both demands a lot from you. So that is one thing. Secondly is the guilt. You know, the guilt again, where you feel that maybe if I'm giving a little more time to one part of my work, maybe I'm neglecting the other. So you know, the guilt also gives you a lot of stress. So that is really very, very challenging. And also, as the doctor just mentioned, we are not from the medical field. So again, it becomes very difficult. You know, every now and then you cannot just keep on calling the doctor for your help. So sometimes, at times what happens is, if it is a time of emergency, you just call the doctor anytime. But at times where you feel that you yourself feel hesitant, saying, no, I should not be disturbing the doctor now. Now let's wait. You know, let's wait for a few hours and check it out. So things are really, really very difficult and tough. Yes.
And yet you have to continue doing it because there is no option before you also.
Yes,
Right?
in fact, there is no option because you just cannot see your loved ones suffering.
Right,
So you want to do the best that you can do. At the same time, the way they undergo their pain, they have during this period, they go through a lot of mental and physical, you know, stress too. We also need to take care of the emotional side of the patient. That I think is one of the most important thing the caregiver has to take care of.
Right.
Because when it comes to medicines, we follow the prescriptions that has been given to us by the doctor. But when it comes to the emotional part of it, it's all on you, how you handle their emotions.
Absolutely. I think many of us have gone through it. I know we have all aged parents or our grandparents, etc. But you know what Roshni has just brought out are very significant points, which I'm sure is relevant to many caregivers who are perhaps watching this program or who has gone through it. So ma'am, let's come back to this again, the point of being untrained. Right? Because they are not trained. And secondly, they are not perhaps also ready. Sometimes when you are a single child, you're the only child of that parents, often these responsibilities are also thrusted upon you.
Yes.
Yeah, because as Roshni said, not all of us, because of various reasons, can afford a paid caregiver. And then the question that a paid caregiver may not be able to do a job that well as you would do. So let us come to this question of the readiness of a caregiver. You know, so how do you look at it when somebody is not ready and yet has to go through with it?
Yeah. So when it comes to a family member who is sick, and someone have to take care of them. First, though, the emotional part comes in, that seeing someone very close suffering, it's very much disturbing and stressful. So what I feel as a professional, first and foremost, what is necessary is having a practical approach to it. So the person who have to take care should understand the situation that I have to take care under all circumstances. So at that time, the person should rather focus on staying calm and stable, and then gather as much knowledge as possible regarding the condition the person is undergoing or the say loved one is suffering from. So for that, the caregiver should be in constant touch with the doctor, because many a times we find that there is lots of misinformation, because they talk to some neighbors or some people say that you do this, you do that, and ultimately it is detrimental to the patient.
So not all information in Google is also correct.
Yes, and that's why I should always be in touch with the treating doctor. Talk to the doctor, understand the sickness, and also try to know how to take care of. Talk to the doctor will definitely explain the do's and don'ts, what is to be done and what is not to be done, regarding how to give the medicines, when to give the medicines, how to monitor the patient. So gather as much information as possible. This will also build the confidence of the caregiver. He or she will feel confident in taking care of, and there won't be much mistakes. Along with that, the caregiver should also focus on understanding the mental state of the patient also. It's because caregiving is not just giving the care, it's building a compassionate, empathetic relation with the patient. So along with taking care, should keep on motivating the patient from time to time, encouraging them to take care of themselves too, so that they can come out of the situation they are suffering from.
Right. You know, it is not an easy task at all. I mean, we may think that it is an accepted and given situation and one must do it. But then a caregiver alone understands what that person is going through. Because as I said in the beginning, he or she may have her own career, her own life, you know, apart from caregiving, and yet has to go through it. So Roshni, I come back to you again. I'm sure there are a lot of positives also, isn't it, about caregiving? Because you build a kind of that bond, you know, and especially that bond keeps growing. You feel more and more attached to that person. But then apart from these positives, there are also negative, because you are getting impacted, as you said, seeing a person suffer and not improving. Personally, how has it affected you? Or because you've lost your dad also, you took care of him, and now you're taking care of your mother also. How has it been for you, this journey so far?
It's very obvious when you take care of the loved ones and ultimately they leave you. It's something that you take a lot of time to recover from that. And as you said, every aspect or everything in life has its good and bad, positive and negative. Positive is, let me start off with the positive.
Right.
We have a lot to talk about negatives, you know. The positive aspect is that I think personally you grow, you become very strong. Over the period of time, you become very strong, and as doctor said, you need to motivate the patient, that the loved ones that who is suffering. So you keep motivating, and then at times I've realized, this is my personal experience, when I would tell my father, "You'll be okay." I had some kind of hesitant in my voice that he could feel, but later on I was so confident, "You are going to be okay." And I also felt that, okay, I'm very strong, and it is not affecting me. So these are the positive things that, you motivate your loved ones. The patients feel that, okay, she has the full confidence in me, I'm going to recover, I'm doing well. That is one thing. The negative is you are stressed. And as I say, to balance between, your professional life and your personal life.
And professionally also it is
difficult.
Stressful, right?
It is stressful. As I said, the guilt, a time comes when you are more towards your personal life than on to your professional life. So when you are taking and giving care and then working on your personal part, somewhere you feel that professionally you are being neglected. Definitely it has its own setbacks again. So
so how do you balance, like balance? Yes, I'm not talking about the time factor. I'm talking about how do you calm down your mind and be with yourself, because it is so important once in a while that we be with ourselves, we give that me time to ourselves. So how do you actually motivate yourself also, because apart from motivating your loved one you need to motivate yourself. So what do you go through? I mean, what is it that you do to yourself also to continue being strong?
I believe that one should have a short period of maybe half an hour time for himself or herself. That is very, very important. In that half an hour of time, 1 hour if you can get it, nothing like it. But if not, 30 to 45 minutes time, you have to get it for yourself. It's up to you how you're managing to get that time for yourself. Maybe you're enjoying your coffee, maybe you're watching, anything, YouTube, or maybe you're reading, which relaxes you. Maybe you go for a drive or a walk. So anything that by doing that, what calms you or what relaxes you is very, very important. So you strengthen yourself by doing that. As we say, a nap of just a few seconds, a power nap, what you call it, you feel refreshed. So definitely you need to have that 45 minutes or 30 minutes of time.
Which you do for yourself
I
also.
do it for myself. Where maybe I'll take a book and then just go through a page which relaxes me a lot. I think we should all do that.
Yeah, all the caregivers especially.
All the caregivers.
Ma'am, I come to you, Dr. Chainika. Is it necessary for certain caregivers who have reached that limit, that he or she cannot do more than, because see, at the end of the day, we are also humans. We also have our limitations or our limits beyond which we cannot handle the stress, and we are seeing a person sick day in, day out. Person may be losing that, our loved one may suffer from Parkinson's, or say from dementia, from other disabilities. Those are very, very challenging. So is it also required for a caregiver sometimes to come to doctors like you to, discuss these matters, to look for clinical help as well?
Yeah. As a caregiver, he or she should always focus on their own physical and emotional well-being. So for the physical well-being, they should eat a proper diet, adequate balanced diet. They should have proper sleep. Then they should have a healthy lifestyle. They should avoid substance abuse, which makes them restless. And along with that, they should do things that make them happy. Do physical exercise to keep themselves healthy. Along with that, they should, for their emotional well-being, they should do some relaxation techniques like deep breathing exercise, yoga, meditation daily. Along with that, say some moments of spending time with nature. And as Rosni said, spending time with themselves, reading motivational books and quotes.
But do they also need sometimes counseling?
Yes. At times, if suppose they are not able to help themselves and they feel that they are just burning out, because this caregiver burnout is very common.
Yes.
If they are doing things beyond their limit or beyond their capability, neglecting themselves totally, they have this emotional burnout. And when they have the burnout, they start getting withdrawn, they feel restless, they cannot work proper.
And I think they get very emotional, they get angry also in matters.
And at that point, first of all, they should talk to someone with whom they feel comfortable.
Okay.
So they should always have a support group. So for many sicknesses, there are support group where people with the same, caregivers with the same type of situation, they gather and discuss.
Absolutely. So this is very common outside,
yes. So if they have a support group, talk there, or with anyone with whom they feel comfortable, just try to talk. Even if after that they are not getting relief, then they should definitely go for professional help. Because, and many times because of the stress they undergo, they may develop some mental issues like anxiety, depression, phobia. So this has to be handled professionally. So if they find that they are not able to cope with the situation or it's affecting their day-to-day functioning, they should seek professional help, because with medicine and counseling they can come out of this situation.
Yeah, and you must have handled such situations
Yes.
also. There must be people coming to you,
Yes,
isn't
yes.
it?
Patients are there. Many caregivers, they do come for professional help.
Right, right. I mean, what you said is so important. As a community also, we must be a little bit more, caring. Yeah?
Yes.
Our extended family must also lend their hand, lend support to such people, because we have family, a core family. We also have extended family. Sometimes some caregivers should be given, some relief by somebody else coming and saying that, okay, today I'm there to help you out, or a neighbor or a community member, right? Because we live in a society, and as a society we also need to play a role. Yeah. I give hats off, I think a big salute to all the caregivers who are handling aged parents or grandparents, or maybe mentally challenged person, physically challenged person in the home, day in, day out, and also taking care of their own well-being. Roshni is an example of that, and like that many others also. Quickly, as we are almost wrapping up this program, Roshni, what will be your quick words to the people and who are caregivers like you who are watching this program? How will you build their confidence?
Keep doing good work. I think when you feel satisfied in what you are doing, when you are happy what you are doing, then I think that keeps you going. That's the only thing. I think we should not hesitate to be a support system to others. And small things like being depressed and stressed keeps coming in our life all the time, but when it comes to giving care, I think we should keep going, build ourselves, take the advice of the doctor, little tips, whatever she has done, she has given us today. I think we should follow that, and we should do our best.
Absolutely, because when we were young, when we were children, our parents took care of all our tantrums and help us grow. So I think when it comes to taking care of our aged parents or anybody else in the family, we should, it's a payback time. Quickly, doctor, any words of advice, and should you also encourage those who are drained out completely, burnt out completely, to also seek professional help?
Yeah. See, caregiving is a very noble work. You are giving care to someone and helping someone live a very comfortable and normal life as much as possible. So first of all, love your work and have a positive attitude. If a caregiver does work under compulsion, the frustration will rather pull them back from giving their best, and rather they'll be also suffering from lots of turmoil and stress related issues. And along with that, the caregiver should have lots of patience, because you are dealing with someone who may need time to work, who may need time to communicate. So have lots of patience while dealing with a sick person. Be empathetic, compassionate, understanding and caring. And at the same time, build very good communication skill, which will help you communicate and help the person who needs your help. And most important, also take care of your own physical and mental well-being. And if the situation is such that you are not able to handle it, please go for professional help.
Absolutely, absolutely. I think this is what the target was of this program. Not only to talk about caregiving, to understand the role, the challenges, the positives. I will not call it negative, but definitely the challenges of it, and give support to all those caregivers who are there taking care of their sick and infirmed people, family members, day in and day out. And a big salute, of course, to all of them. And as doctor said, that continue to do this noble work, because I think blessings comes in different forms, and at the end we will be blessed by the blessings of the loved ones whom we are taking care. So, Dr. Chainika, thank you so much for coming to the studio and explaining so much, in detail about a caregiver's role and what it encompasses and how to deal with certain challenges that he or she has to go through. And yes, Roshni, to you too, for explaining your situation and that you're loving doing it actually, right? I mean, it's not it's not at all a burden to you, but then yes, it is difficult at times, and that you have shared your experience to us because you are speaking on behalf of many others who are doing it day in, day out. Thank you so much. And then viewers, I hope you have really understood this very different topic that we have taken up. It is an important issue that is not often spoken of because, as I said in the beginning, it is often taken for granted that a family or the other members of the family should be able to take care of their infirmed or their sick people at home. But it is not an easy task, and as a community, as members of family, other members of the family, we have to be empathetic to the role that a caregiver provides. Thank you very much, and you take care of yourselves. Until next time, from all of us here is wishing you goodbye.